Hello and welcome to the Penguin Prof channel in Italia. This is a part of my Art and Anatomy in Italy series, and I have a really special video for you today. If you study or teach or practice in the medical field, you know how challenging it is. And with all of the textbooks and the lab manuals and the posters and the specimens and the models and the digital media, it's still hard. But what if you didn't have access to all of that stuff? What would it be like to practice medicine having really no clear idea of what the inside of the human body looks like, let alone how it works? That's what we're going to explore today. We are going to go to the birthplace of the modern university and really the birthplace of the study of medicine in the modern sense. We're going to the University of Bologna, which was founded in the year 1088. It is the oldest university that has been in continuous operation since its inception. And the collections there and the things that you can see will blow your mind. And I just want you to know, all of these places at the university are open to the public. So if you find yourself in Italy, get yourself to Bologna and see them for yourself. But for now, I'd like for you to sit back and relax and enjoy this tour. Before you do that, take a second, click those buttons below. Please like, share, and subscribe. Also a shout out to Audible for sponsoring this project. Our tour guide today will be the anatomist Dr. Kevin Petty from Anatomia Italiana. We are really taking a bit of a time travel today, so thumbs up if you like time travel, and enjoy. Andiamo.
We're here at the University of Bologna, one of the first universities in the modern sense, and this is the Department of Human Anatomy, a functioning building at the University of Bologna Medical School today. And in this particular room that we're in right now is the Luigi Galvani collection of human skulls. About 2,000 human skulls composing one of the oldest anthropological collections in the world, where we see skulls categorized by individuals with various maladies, such as being deaf or having various forms of mental retardation, as well as people who died from suicide, people who aren't from the Italian peninsula, and so forth. So this collection of 2,000 human skulls is also a very important aspect of the story about anatomy along the Italian peninsula. Here at the University of Bologna, we're at the Luigi Galvani collection of anatomical waxes. This collection is mostly 19th century and focuses on pathological anatomy. Although there is a fair amount of normal anatomy, pathology was more of the focus. Most of the specimens are wax, however, there is also a fair amount of natural specimens as well, largely natural bone. Anytime you see bone and wax here, the bone is always natural, and that's the Bolognese waxing technique compared to the Florentine technique, which uses wax for the bones. Some of the more stunning wax anatomicals at the Luigi Galvani collection here at the University of Bologna are the neuroanatomy pieces done by Cesare Bettini in the 18th century. You could see that these are maybe 3 times normal, and to get some scale, you can even look at these skulls that are at the very bottom shelf. These are natural bone, so you could see natural human size for the head, and you could see these oversized brains to help teach anatomy to medical students throughout the 19th century. Another significant contribution of the University of Bologna is that of pathological anatomy, and we see that wonderfully illustrated here with these 3 heads over here. These 2 are waxes, and this here is natural bone for the same patient. The 2 waxes were molded from the patient while she was alive, seeing the progression of this cranial tumor, and then she was dissected after her death. So we see now anatomy being explored more than just to understand the structures of the body, but to also understand the progression of disease. And pathological anatomy as a science indeed began here at the University of Bologna. And this idea of these artists doing anatomy, be it either pathological anatomy or normal anatomy, beginning here in Italy, is just in the long line of contributions in anatomy that occurred. Anatomy in the medical curriculum began here at the University of Bologna. Then we wind up seeing the first anatomical textbooks that are richly illustrated and decorated artistically, and then that evolving into the uses of anatomy to be displayed in waxes anatomically and artistically together. Another contribution of the University of Bologna is obstetrics within the realm of medical doctors. prior to that, it was the midwives that were largely responsible for the delivery of babies. But it was Giovanni Galvani here in the 18th century that we began to train midwives from a more medical anatomical perspective. He commissioned all of these many anatomical uteruses to be done out of clay because it was cheaper than the waxes that are in other parts of the museum. And additionally, he also commissioned the construction of a birthing machine, which is a wooden pelvis with a glass uterus on top of it, and then he would insert into it a flexible doll that the training midwives and training obstetricians would have to therefore insert their hands to reposition for a breech presentation. And then students would have to do it blindfolded. So with glass, it allowed you to see it while it was being done, and then blindfold yourself and then be able to do it to see if you could properly position the fetus for delivery. And additionally, he also commissioned a birthing chair, which is not unlike what we see in modern obstetric rooms today, where you could wind up assisting delivery in that way. So it was here, Galli was the biggest contributor, and then eventually it was Luigi Galvani, who was an obstetrician. Many people think of him largely as being just strictly neurophysiology, but he was also extensively involved in obstetrics as well, and all of that occurred here at the University of Bologna. This room here is dedicated to the works of Ercole Lelli, who's the original creator of the first wax anatomical collection for medical education here at the University of Bologna. So this in the 18th century. Lelli trained from Zumbo, who did those first heads that we saw at the University of Florence. So if you look around, you'll get to see what he focused on, which was largely myology and osteology, where he sculpted wax atop natural bone. And we wind up seeing it different in the Florentine school, where it was wax bone with wax musculature and other organs on top of that. This dissecting table here was used by Luigi Galvani in the 18th century. It was Galvani that we consider to be the father of neurophysiology, this idea that it's electrical activity that animates muscle. His publication about that gained wide attention all throughout Europe in the early parts of the 1800s, and it wound up influencing many people, including in literature. And it influenced a young couple, a young woman in particular, who used to take hikes throughout the Alps, telling scary stories at night, and wound up probably being the foundation of a book that she wrote. You probably know her name, Mary Shelley and Frankenstein, is largely influenced by the work of Galvani and his writings about how it's electrical activity that animates muscle. So we see anatomy not only influencing art, but also literature as well as vocabulary, because when you think of the word to galvanize, it comes from Galvani. To galvanize means to leap into action, and that's exactly what we saw when the electrical activity was used to animate the frog leg down the sciatic nerve. It would leap into action. Again, the University of Bologna, a perfect place for the synthesis of art, science, culture, literature, and language. So this room here is dedicated to the works of Giovanni Mancellini and his wife Anna Miranda Mancellini, who were trained by Ercole Lelli and focused their work largely on senses and reproduction. They did many of the reproductive biology birthing pieces that we saw in the other room. Mancellini and Miranda Mancellini, both of them together, created quite a significant corpus of work, and we see their own self-portraits behind us over here. And it was a big deal in the day for Anna Miranda Mancellini herself to be a woman who was an anatomist as well as an artist, and she lectured anatomy at the University of Bologna as well. If you see in this last room over here where we'll go, you'll get to see the Venus, this little Venus called the Venerina, that was done by Clemente Susini, didactic in its purpose as well as artistic. The pieces come apart so that it can be used for teaching, and you can see all of her pieces of her organs laid out about her. So the University of Bologna likes to recognize many of the important faculty, and there's two examples right here in these frescoes that are behind me. Here we see Antonio Maria Valsalva. You probably recognize that name right away as the initiator of the Valsalva maneuver, right? Holding the breath and forcing to test the patency of the eustachian tube. Many people think that the eustachian tube was discovered by Bartolomeo Eustachio, and that is true, but it was Valsalva that named it and coined the term, giving homage to Eustachio for identifying the structure. He was an important anatomist in many other ways, as a physician especially. He was more of an advocate for the mentally ill, for treating them more humanely. And also, back in the day, when you had injury and wounds, they would cauterize and burn you to heal, and he was a proponent to stop doing that particular procedure. And when you look over here, this is a fresco to Marcello Malpighi, and you may be familiar with the eponyms for Malpighi, the Malpighian corpuscles, the Malpighian pyramids, Malpighian tubule of the kidney. We look at Malpighi as the father of histology. Although the microscope had already been invented, it was Malpighi that turned it towards human tissues. Okay? So Malpighi was essential in that, as well as identifying histological influences associated with pathology. So these are two important people from Bologna that are celebrated in a very beautifully artistic way here. Welcome to the ancient dissection theater at the University of Bologna. The University of Bologna dates back to 1088, and we could argue that it's the first university in the world. The University of Bologna that we see for the first time, the paradigm that we use in the modern university, where you see faculty being paid by students at an institution that's granted a charter by a commune for there to be a series of courses and a curriculum for a conferred degree to practice a particular discipline, starting with the liberal arts, grammar, logic, rhetoric, moving on to law and eventually medicine. The medical school at the University of Bologna dates back to the 13th century, and by the year 1306, anatomy began in the medical curriculum. The University of Bologna is the first place where we see a cadaver dissection, human anatomy, required for graduating from medical school. And that occurred here. Students were required to participate in at least one male and one female dissection prior to graduation. Initially done very small and informally, probably in the professors' homes, and eventually into venues like we see right here, where it'd be more formal public dissection. This room over here is actually in response to other theaters being built at other universities, like the University of Padua, which we will go and see in a little bit. That's the oldest one at 1595. This room wasn't built until 1628, and it was used for over 150 years as a dissection theater. And if you look at it didactically speaking, it's not particularly effective, as you can see, to think that, yes, the cadaver would be here, but students would be so very far away. However, this room is important in many ways because we see this was the paradigm that it indeed was taught, where the professor would come in and ascend to the cathedra. That's where we get one of these words that we use today in academia, the chair, the department chair. The chair was a lofty place, and the professor would wind up lecturing from there, probably from the books of Galen. Remember, Galen in the 1st century AD wrote all that was necessary to be known about anatomy, and the first anatomy textbook that began to be the modern anatomy textbook was by Mondinus de Luigi, and we see his statue over here almost front and center. He was the first anatomist that required it, as I mentioned before, anatomy in the medical curriculum. But Mondinus's book was more of a recitation of Galen and really didn't have much new anatomy. It was just more, if you will, a dissection manual, as far as here's the order that we're going to go through: the viscera first, then the peripheral limbs, and then the cranial cavity, and wound up describing it really. An anatomy textbook in the medical curriculum, yes, it's the first one, but no way a modern one. That didn't come until Vesalius in the mid part of the 16th century, okay? So we see other anatomists being represented over here, not just Mondinus, but we see Galen and we see Hippocrates as well. So all of the greats are being recognized in this particular room. So the University of Bologna, the first to require anatomy in the medical curriculum, one of the first and one of the oldest ancient anatomy dissection theaters. And it's also important maybe in a more modern context because this building was bombed heavily during the Second World War and damaged, and you could see by the door they have photographs of what it looked like before it was reconstructed and put back together from the original pieces. Okay, so this room should be a temple to people like us who teach, because this is the beginning of what we're doing in our anatomy medical curriculums today.
As always, I hope you found that informative and inspiring. If you did, please click those buttons below, like, share, and subscribe. Join me on Facebook, follow on Twitter. Ciao.